And welcome. Oh, got it. Recording in progress. Welcome everyone to the Systems for Health Working Group. We're very excited that you are here. I'm Kristen Mallory, one of the new co-chairs, part of Children International and part of Core Group. Really excited to kick off our time with you. I'll pass it over to Adugna so he can introduce himself.
Sorry, it's not visible. Okay, my name is Adunya. I work for Action Against Hunger, and I'm one of the co-chairs for this technical working group. Nice to be here.
Thank you, Adugna. And we're also representing Cora Nolly from AmeriCare. She is the third co-chair. She is responding to emergency right now, so doing very important work, but here in spirit with us on the call. So for today, we thought it could be helpful to get to know one another. We would like to propose a quick icebreaker in which we'll put everyone into groups of 2, potentially 3, just for a few minutes to share kind of who you are, a little bit about your experience, and more importantly, what brings you to today's meeting. So maybe a bit about your expectations or interest in the group. You'll have about 5 or 6 minutes for the small group work. And then from there, we'll come back and we'd like to ask that you present or introduce the person whom you were paired with to the broader group. Give me a second to create our groups. I'm going to send everyone into the breakout rooms just for a few minutes to get to know one another. And we'll meet back in the big group about 5 or 6 minutes later. So see you soon.
Nutrition.
Okay.
So I'm based in Washington, D.C. Before that, I used to work for World Vision International. My background, I'm a physician, but I have been working on public health for the last close to 25 years. So that's my background.
And why are you interested in this group?
Well, I'm part of the co-chair because partly it is where I see some of my expertise and experience can be, of use in terms of, sharing with others and learning from others. I've been a member of the core group since 2000. So this time I thought probably I can contribute, as a co-chair to this particular group so that we can bring in the different experience from all over the world and, just add value to what people are doing out in the field.
This is my first time in this. Thank you very much, Adugna. This is my first time. So S for health, right? Like how?
Systems for health. Systems for health.
Systems for health. Okay. Well, I can go next. Hi, Arafat. So I'm Nilufar Rahmanova. I work for FHI 360. I'm based in Washington. I'm also a physician like you, Adugna, as a background, but now I consider myself more as a international development practitioner. Yeah. But also kind of my expertise more in quality improvement, quality improvement in service delivery. But my thinking about quality improvement changed after Lancet paper was released in 2017, High Quality Health Systems, where, basically they were saying that quality is not just training, retraining, supervision, and, it's much more. It's a lot of other things. And, for quality of care, the entire system should be mobilized, optimized. So I was so inspired. And at that time, I was in Cambodia, chief of party. And I just was driven by these ideas and implemented the project with those ideas in mind. So I'm very inspired when I think about systems, but I understand that there's a lot of things that are unexplored, it's abstract, and different people understand very differently what systems are. So I'm curious to see, what are others thinking, and how can we come to a common denominator? So that's what brings me here. Thank you.
Great, thank you. I appreciate that.
Great to see you both, Adugna. We have met in person and virtually as well many times. I'm Arafat Safi. I'm the Operations and Membership Manager for Core Group. I have been with Core Group for about 17 months now, and not a physician or not coming from a medical background at all. My previous job was with the Ministry of Foreign Affairs of Afghanistan under Foreign Service. And prior to that, I served the Office of the National Security Council of Afghanistan under development and a security portfolio. I have my master's from University of Manchester in international development and security. But my track record and my career record has been that I've been switching jobs and taking a taste of different careers, starting from the management information systems to procurement, operations, and then program management, and ultimately foreign service. And here within Core Group, my portfolio is that I look for our membership relations, entirely the membership connection with the core. Membership is a very important portion of Core Group. It has always been. And because of the membership and the project portfolio that Core Group has, it's called the hybrid model of an organization. I facilitate and help our members in such events. And in the working groups. The working groups are one of the benefits that the Core Group offers to its members. Our expectation from the group is to enrich the discussion within the groups, come up with new ideas that can benefit the whole group or the global community and the health that we are part of. So happy to be part of this group today, and looking forward for the meeting.
So Arafat, thank you so much. Can I ask you a question?
Sure.
So when you said about the working groups, did you mean for the S for health, systems for health working groups, or like you are as part of something else?
No, we have others as well, and I have to be coordinating with all other groups. We have we have a number of other working groups as well. I would share the link in the chat later on, and then you can see what we offer and also what our membership offers. And FHI is one of our members, and under their membership, you can also benefit what we offer. So being part of the working groups, attend our conferences, and benefit from what we offer there. And also take a use of listservs. We have a listserv where a lot of discussions happen. Okay, so
yeah, I mean, thank you so much, because I do not utilize fully. So thank you for that. And I think that we should be going back.
Yes.
So who amongst us will be? I guess, is it expected that we have to introduce, like, or?
I think, yeah, a short brief of what the expectation from this working group is and why you are part of this meeting today.
Okay.
You're gonna do it?
I'll be happy to introduce you both. Oh, do you want to do this? But just forgive me if I will be.
Oh.
Hello, welcome back, everyone. Nothing like an early morning for some of us icebreaker. Hope everyone's had a cup of coffee. So for introductions, we thought it could be interesting if you could quickly share just a little bit about the person who you were grouped with, their name, maybe where they work, but more importantly, any interests or expectations maybe they have for this group or anything else that you talked about. So just to kind of streamline this, I'll select people if that's okay, and then you can share with us who was in your group and a little bit about them. Okay. Dora, you are first on my screen.
Okay. I got the opportunity, the good chance to get to know Richard Killian, who is with RTI working in NTDs. He's the lead for health system strengthening, based in DC, but with working with a team that's based in multiple different, with advisors based in lots of different countries. We had a couple of connections. I work at Task Force for Global Health, which does a lot of NTD work. So we knew some common folks, and he just said he's been engaging through listservs for a while and is interested in getting to know more, especially from that sort of NTDs sort of touch a lot of different areas, and it's good to get to the more holistic perspective of the system strengthening.
Excellent. Thank you, Dora. And we'll go to Richard now. You can share with us a little bit about Dora.
Yeah, thanks. It was a pleasure to chat with Dora and get to know her a little bit. And as she said, I know the task force does a variety of things, but definitely some work with NTDs as part of it. Sounds like Dora has she's a native of Atlanta, so she's lived and worked in Atlanta for a while, and sounds like has had a longer involvement with the core group, Systems for Health group. I've been kind of connected on the listserv for the past most of a year, I guess, but not really participating in meetings, and so I'm really interested to get more involved. But yeah, it was nice getting to chat with Dora and get to know her a little bit more. I think she said she's 4th generation in Atlanta, which was interesting.
Very cool.
Thanks.
Thanks, Richard. Welcome, Dora and Richard, and thank you both. Let's move to Lori, a previous co-chair of this group. Nice to see you.
Oh, I didn't know you knew that. Okay. All right. A few years ago, though. Yeah, so I'm going to introduce you to Dr. Wastina. She is currently in Somalia. As you can see, she works for Action Against Hunger. She has worked for them for a while. We didn't talk numbers, but in different places in mostly East Africa, as I understand. And she is a medical doctor, emergency medical doctor with an MPH, and is keen to be in this group because she's interested in building systems from those fragile times, building systems to be sustainable. She is currently working on a project in Somalia with the World Bank. So they're working in a large project for 96 facilities to improve primary health care. And let's see. And her husband is in Grand Rapids. Because we talked a little bit about Michigan. So yeah.
Excellent. Thank you, Laurie.
Mm-hmm.
Dr. Wastina, do you like to share a little bit about what you learned about Laurie?
Yes, thank you. Yeah, it was nice to chat with Laurie. She's a very, very approachable person, if I can say one. So Laurie is currently teaching at Michigan State University and Global Health Management. She has very big experience, large extensive experience on health systems in different countries outside of the US. For more than 25 years. She has worked in Africa also. We talked a little bit about systems in Africa. She is currently interested in creating students in creating, the global health workforce with a wide approach, system thinking. And yeah, I don't know if I missed anything, but yeah, I really liked chatting with her.
Great. And we also had a third person join our group.
Yeah.
Maladul, I don't know why that's Maladul. He joined us in the last minute or so. I will give a few points. He is currently a master's student, public health, I'm assuming. Is that right? No, master's. Oh, open your
Global health.
global health. Sorry. Yeah, I get public health, global health. In Manchester. He's from Canada. His heritage is from Afghanistan. And it's Arafat who got him hooked up to this group. So we're welcome him, and hopefully he will continue to join us in this. It's a good group. We are big thinkers. So thank you.
Excellent. Thank you. Welcome to all three of you. Let's see. Let's move to Lara. Go.
Hello, I'd like to introduce Dr. Olayemi, who has been working at Medabeth Global Health Center in Ocean State, Nigeria. Dr. Olayemi has been working in the maternal child health and sexual and reproductive health field, but it's raining very heavily in Ocean State, and we were unable to actually talk. But I do see his picture now. Do you want to finish? Because we actually were only able to chat in the chat box.
Okay.
Good day, everyone.
Great.
You can hear the rain in the background. Nice to meet you. Welcome. Lara, do you want to give a brief kind of introduction of yourself?
Sure. I work for URC, and I've been very active in the RMN-CAH space. Like Richard mentioned, I have been observing from the listserv, but not participating. I'm very interested in, strengthening primary health care, and that's part of the reason I wanted to kind of come and check this out. And thank you for letting me participate today.
Of course, welcome. Thank you. I'm seeing in the chat, Sydney and
You have also Nilufar.
yeah, Agugna, do you want to continue?
Okay, I was with Nilufar and Arafat in our group. Nilufar is from FH360, and one of the reasons why she wanted to join this group is because she had a chance to read the Lancet publication some time back, which focused on quality improvement in the health system. And so she feels, since then, she feels strong about, making sure that there is quality in the service that we provide through the health services. So she wanted to contribute from that angle with this technical working group. And she has extensive experience in development around global health. And also she has been a chief of party before joining FH360 in Washington. I think I'm okay.
Thank you for the beautiful introduction. I'm happy to introduce Dr. Adugna. He has over 20 years of experience. He's also a medical doctor, just like me, and but he has this multiple years of experience and wisdom in various health systems and low and middle income countries, and that's what drove him to be part of this group and actually co-chair and share that wisdom. At the moment, he works for the Action Against Hunger, and he even mentioned that I think that there is some partnership with FHI 360. So it was really great to connect with Dr. Adugna. And then we also had Arafat Safi. He is also one of the core people in the core group. So he is from Afghanistan. And what's interesting from my perspective, I don't know, Lori, you're a systems thinker. So to expand our systems thinking, it's always good to have people from different other systems. And Arafat, he said that he's not a doctor, but he has worked in Afghanistan for Ministry of International Affairs and then in Foreign Service with various systems other than health. So, he brings that perspective. And at the moment, he facilitates various working groups. And he even started talking to me about the benefits of the core group. So, yeah, thank you for letting me introduce them.
Excellent. No, thank you. Welcome. Nilufar and Arafat is our representative from the core group staff on this group. Didn't know your specific passion though in health systems, Arafat. So glad you're part of the team.
Thank you, Christian.
And then it sounds like we also have in the chat, Adugna, do you want to read what's in the chat from the other group? Are you able to see that? You're on mute. Adugna? We can't hear you. Sorry, you're on mute.
Sorry.
You're fine.
So they are traveling actually.
Okay.
So they happen to be in the same group. So Cindy and Kauto Bouchard, I'm sorry if I am pronouncing wrong. So Sydney is from Haiti. She's interested in community health, and she shared with people in the same field of expertise as is the public health specialist. And then Kauto Chad said, I'm Chantal, okay, working with PUI, former Action Against Hunger, for many years. I'm in the headquarters based with nutrition, an interest in community. Okay, I'm not sure how I was included in this group, but having impression, it could easily be interesting to discover the work we could do. So that's yeah, from the two of them who are traveling.
Excellent. Thank you for helping me with that. And then I think the only other Sarah, I saw you joined. We did some breakout rooms just to get a sense of kind of who's who and any expectations or interests we have for this group. So if you were able to share or put in the chat, please feel free to do so. Okay, so we will continue to move on. Thank you all. This is one of my favorite parts about core group and the working groups is just getting to know one another and starting to see overlaps, synergies across our work. So hopefully these conversations can just continue even after this meeting. We thought it could be helpful to start out today's meeting just reminding us of the vision and some of the interest areas within this group. So it sounds like some of you have quite a bit of experience engaging with this working group, and for others, this might be your first time. So the vision of the Systems for Health Working Group is to promote people-centered, community-inclusive systems for health, which deliver expanding packages of health interventions tailored to specific contextual needs and opportunities, connecting social and healthcare structures, valuing prevention, health promotion, and the agency of communities to own their future. We are interested in cross-cutting issues which contribute to strengthening systems for health, such as, here are just a few of our interest areas, one being full integration of community-based systems into national health systems and strategies, community health, human resources. In the past, there has been some collaborative work done around community health workers, community management structures, social capital, civil society engagement. Over the past few years, there's been some work streams specifically related to social accountability and kind of trying to build the evidence base around that. And then, there's social accountability, health systems responsiveness. So here are some of the current interest areas. This doesn't mean that this could not expand based on members' interest. You may have seen in the invite that we sent out last week, there was a survey link. We wanted to get a sense of the base and just sort of interests. So after this meeting, we will send the link again in case you didn't have a chance to fill out the survey. But some of the key things we heard from members who did fill out the survey, one was we asked about frequency of these meetings, and consensus was a quarterly meeting. So meeting maybe 4 times throughout the year, keeping kind of engagement and momentum around the group. And then in terms of how people said that they wanted to engage, many mentioned learning from their peers, collaborating on shared products, socializing work and learnings outside of this group. So finding different forums and platforms to socialize what we're building. Some mentioned that they'd be interested in mentoring members within the group. And then there were some comments just on inclusivity and how can we continue to encourage inclusive spaces and really bring more voices to the table. I think today it's interesting to see some of the diverse both settings and experience that even the small group brings to this conversation, and we want to figure out how we can keep that happening. We did want to provide just a couple quick updates. And I should have mentioned in the beginning, but we wanted to thank Rhonda Holloway and Camden Hoffman, who were the previous co-chairs of this group for at least 2 years, I believe. A lot of interesting projects happened during their tenure with the group, one of which was creating a social accountability resource hub. So this is housed within the core group website. The link is here. And the idea was this was a work stream done through the working group with the help of an intern from Johns Hopkins public health program, was to bring all the evidence together in one place. We know that a lot of core group members are interested in social accountability. And so having a place on the website in which people could easily figure out what it is, what are some of the key tools that have been used and strategies, what are some of the main players in that realm, and then also a pretty exhaustive repository of just all the things published. Now, as you can imagine, a repository is only helpful if it continues to be live. And so as part of our group, we would like to figure out the mechanism to keep updating this, because even in the past year, so much has been published around this. So that's something that we want to continue to add to over time. But this is an example of maybe one of those shared products that was developed over the past couple of years in this group. Some of the plans that we've thought about for 2024, one, creating the cadence of working group meetings. The current proposal would be having quarterly gatherings, and then figuring out how we can really optimize these spaces. There has been an interest to include technical share outs from members. So maybe sharing, what's interesting in your work currently, or inviting special speakers based on interest areas within the group. So we'd really want to co-create what those agendas could look like with group members. We also thought it could be interesting to create a calendar of events for 2024. What are the conferences and spaces that our organizations will be participating in? And are there opportunities to create panel discussions or co-speaking opportunities, abstracts together? So first and foremost, getting that calendar visible to the group, and then maybe starting to work on things together. Also, based on group members' interests, figuring out if there are projects that both align with individual organizations' work plans and maybe a collective interest of this group. For those of us that have been involved in these working groups, it's really hard sometimes to get additional effort from members on projects that don't align with their particular roles or work plan within their organization. So whenever we can find those synergies, it's much more effective in terms of getting work done. So very open to what those types of projects could be. And also looking for leaders within the team or in the working group that would be interested in maybe leading a work stream or a particular project. So very open to ideas around that. I'd already mentioned, we want to continue to keep the social accountability evidence repository up to date. And then we're also very open to other ideas that members may have. We also wanted to make visible that in March of 2024, the core group is putting together a 2-day technical workshop in DC. They have a new office space. So that office space is going to host this event. The idea is, making it very affordable, small cost for food to participate, but really trying to engage members. Obviously, those living in DC, more accessible, but if there are those who would like to travel, that would be an opportunity as well for members to consider. All of the working groups have been asked to propose possible sessions that meet some of the goals within the working group. And so as our team of co-chairs brainstormed, these were some of the initial ideas that we had on topics that could be helpful. So private-public partnership to health system strengthening. Adugna had provided that and has some ideas on maybe what that could look like. Resilience of health systems, how mental health fits in within the health system, balancing NCDs, and I recently heard it called NTDs. And it sounds like we have some experience with those on this call today that could maybe weigh into that. And then also this question around climate efforts and how does health system strengthening align, or how could it align? I think that's a question for a lot of our organizations right now. So this was just an initial brainstorm, but we're very eager to hear from others. One, if these are of interest to you, and then if there are other things that maybe we could propose in terms of topics. So I'm going to pause there. And I'd just like to, get a reaction from the group on these topics. One, are these topics that interest you? And then if there are others that also you think should be considered for an event like this. I'm seeing a thumbs up from Sarah.
Hi, can I share my thoughts?
Please. Yes.
Yeah, I would be interested in some of these topics, particularly maybe private-public partnership to HSS. I think resilience of health systems, it's a very probably loaded topic. I mean, and also different people may understand it differently. So I don't know in what context. I feel like maybe it's better to be more specific in topics. Yeah, and mental health within the health system. Do we mean mental health? It's just like questions in my mind, do we mean mental health of providers or mental health services? So because I think it looks like that both of these are issues and raised. Yeah, and balancing NCDs within the health system potentially as well. But my personal interest is systems approach to global development work that we do. So for example, again, from my personal experience, when I was implementing a project, we are responsible for specific things, very specific objectives: improve maternal and child health, improve HIV care, TB care. But what does it mean to do this with the systems approach? That's what I'm very interested about. And I tried to do this by, like I said, I was inspired by Lancet High Quality Health Systems paper. And it was basically that, whenever we do something, it's not just responsibility of a specific department, NCD, TB, HIV. We have to find a way to mobilize bigger system, even beyond health system. So I'm curious, what does it mean when we use systems thinking or systems approach to the problems, any problems, whether it's public-private partnership or etc. That's what I'm curious about, and I would love to explore that if there is any other interest from others as well. Thank you.
Thank you. And anyone want to add to that comment? Is that interest among others? This is the beauty of the working group. If there's more than one, and create.
I would second Lilufa's comment on systems approach. I think that core group focuses a lot on community level health, and I think that is something that I would like us to continue to sort of focus on, because I think that it because that, for me, that's pretty core to actually working in systems. Systems need to support the people who might use services, and so they live within systems every day. And so how do we connect with that and make that work for being a responsive health system? So that interests me. I think it would be good to, if the working group wants to continue to support the social accountability resource, that needs to be one of the workshop topics in some form. Because I think that a lot of effort went into that, and I think it's critical to, again, to those community level kinds of systems, and the influence that you want to have on improving healthcare. So I would like to see social accountability kind of show up again. I know for community health workers, that is really, I think that Impact takes a lot of that work. And so hopefully they will do some work, do some workshops also. They usually are part of CORE in some way, and they have a lot of research on community health workers. But they also were part of this working group a while back, and for that element of making sure that community health workers are part of the system. So yeah.
Just a clarifying question, Lori, on that. There is a group working specifically on that outside of this group. Are you aware of?
Great. I'm not. I've been a little bit out of CORE for a year or two. So yeah.
Well, I'm actually asking. I don't know.
Oh no. Impact is a separate group that works with another coalition of organizations that work particularly with community health workers. Okay. I don't know that much about it, but I do know they do some really great work. Madeline Ballard is the name that comes to mind right now.
And she was very active. I remember on this group a few years back. So maybe that's where some of that work went. Okay.
Yes.
Great. Thank you, Lori. Great insight. Laura?
Yes, I just put a comment in the chat. I really appreciate the previous comments and the suggestion to look at a systems approach. So I'm wondering about talking about primary healthcare oriented systems, because the definition of what that is so grounded in community. Like there's the different domains, multi-sectoral engagement is one of them. The health service, the essential package of that, but also the empowered communities and individuals. And I'm just wondering if we want to think about some of these issues from that lens. So that's all I wanted to say. Thanks.
Of course, no, thank you. other comments, reactions, ideas?
Okay.
Yeah,
Hello.
go ahead.
Yes, I want to suggest that can we have maybe like a short presentation on each topic, and after that maybe each one of us will share our own experience based on our country on each topic and our challenges and how we can overcome such challenges. That's my suggestion.
Thank you. And could you just repeat the very first part of your comment?
Hello.
Hi. Can you repeat the very first part of your comment, please? I'm sorry, I missed it.
Okay, I said, can we have maybe like a short presentation on each of the topics of the workshop? Then after that, maybe each one of us can share from his or her experience based on the topic, and we discuss maybe our challenges and how to overcome such challenges. That's
Okay.
my suggestion.
Thank you for that comment. So, getting a sense of maybe how each of our organizations or work touches on some of this. Thinking about our lessons and challenges around these areas is something that would be helpful.
I think his question is just to get some information about the topics that we are suggesting, so that there is clarity in terms of what we are expecting, and so on. So I just wanted to say that this is not exhaustive. We are just suggesting these topics as kickstart for our working group, to think about. But any idea that has something to do with systems strengthening in health can be suggested, and we can, further assess its feasibility and benefit to the rest of the group. And then, based on their priority list, we can organize those sessions accordingly.
Thank
So
you.
we should be free to provide, suggestions.
Yes, this is a very first draft for just to get the conversation going. And the reality is we probably will only be able to do about 2 technical workshops. So we'd need to kind of prioritize what we think one is most important, but then also if there is experience on the group of someone who might be able to present, share tools, or connect with someone who can, that would also support the creation of this. Meladul?
Yeah, I was just gonna say that how would we measure the benefits or the impact of our work? And secondly, like when initiative or a project is being supported, like what evidence do we need to consider to work on that project?
Okay. So under maybe talking a bit more about the evaluation of some of these efforts and how best to evaluate, and then also let me know if I interpreted this right, but what kind of evidence is required to determine what types of projects?
Right. Yeah.
Okay. Thank you for that comment. Adugna?
It was, I think, the earlier hand raised, so yeah, sorry.
Any other comments on this list? The idea won't be to make the decision right now, but we did want to get this in front of you today so you can start to think about it. In our follow-up notes, we'll send out more questions about this and really would love to hear your suggestions and ideas on kind of how we could even put this together. So if you have interest or experience or connections to some of these themes, we want to know that because we'd want to co-create that with you. Arafat, did you want to make a comment?
Yes, just a few points and updates for our workshops that we plan for next year. We are waiting for a 2-day workshop confirmation date in March, which would be an official event from the core. But we invite all our members from organization to individual and students that they're welcome to plan their events. One of the main reasons we are moving to this new office and the new building is that we would have access to a lot of wonderful conference rooms that we can have a lot of sessions there. We already had a couple sessions by the YPN group. This gives us a lot of bandwidth to plan more, and I've put this forward to other working groups as well. As soon as we could have an event plan from them, we would be able to reserve those rooms for you. And as you stated, we would not expect, but if you wish to participate in catering or any other logistics for the event, you can do that, but we would be happy to facilitate with that as well. Starting from the reservation for the room, any other logistical requirements there, from technology to some other requirements. So we would be happy to do that. And just let me know personally about the dates that you intend, the topic that you intend to present there, the requirements that you would have for the event, and the attendees, the number of attendees. I would be more than happy to reserve those dates for you and facilitate the whole session or whatever you have there. So yeah.
Thank you, Arafat. That's really helpful. Can I just ask a clarifying question? So will there be 2 days defined in general by the core group, or are you saying that each of these sessions could kind of be throughout the month?
Those 2 days would be in March. We're still figuring out the exact dates.
Okay.
Yeah, that's something part of the core group's plan for workshops. But I was opening this invitation to your group and other members who are in this meeting today, that they can also plan and let us know.
On additional events
Yes,
throughout the year.
additional events, any other events starting from today to, we will also be having a day or two for some workshop events in January as well. So kicking with the new year and with the new membership cycle, you might have noticed we were a little bit quieter last year, and in 2023, no conference, just relied on webinars and just a few in-person events. But in 2024, there will be more activities. We send out a survey for having the Global Health Practitioners Conference in terms of where to have it. We had quite equal percentages for the US and the East Coast and West Coast, but given the experience and the interest, the projects that we have and the members population we have in the African region, it would most likely be there. We do not have a decision as yet, but it seems that we would be going towards having it in Kenya, given that we have good relations with the Ministry of Health there. We have a lot of members there, projects there, and the interest from our local partners that they could facilitate with us there. So we might have a conference in the coming year there, probably at the same time we had it last time in October. But the planning will start from the start of the year. So yeah, but for events, for our member events, this is one of the benefits that we offer. Our office is at our members' disposal if they have any meetings. We have an office in DC. And now that we have space for your workshops, for your events, so just reach out to us and we would be more than happy to facilitate.
Excellent. Thank you so much. That's great information. Looking at the time, we've got 2 minutes. I know we've got busy people on this call. So final slide, our message is we want to keep engagement up. We want you to feel like you can propose new ideas. I've been on the working group as a member now for about 4 or 5 years, and it is very different from other groups that I've participated in that stuff can get done, especially when there are a couple of people interested in a similar topic. Just a really great opportunity to connect with people around the world, passionate about similar things, and able to really advance things. So please propose new ideas. Maybe what you saw on the slides excited you. Maybe there were things missing. We already heard some additional ideas. All of that is possible when there is somebody that has kind of the bandwidth and willingness to push things forward and bring people together. We want you to also know that you can share relevant evidence or publications, updates on the listserv related to health system strengthening. We'd encourage you to invite peers or friends to this group, and then propose sharing the great work that you all are doing. This is an opportunity. We heard that people want to hear from peers. They want to learn from one another. So if you are learning something interesting or have some results to share, or even failures, let us know, because all of that we can figure out how to incorporate in the meetings. So we will be sending, Adguna and I will be sending out some notes from this meeting. I think we'll be able to attach the recording and also the slides. And we will be asking for those of you who are interested, one in this workshop, to let us know. And then if some of you are interested in helping to prepare sessions even, that's kind of our number one piece of work, because we do need to propose those by the end of the month. But then from there, we'll also be engaging on when we'll be meeting quarterly. We hope to have a meeting maybe February timeframe, so giving some people some time after the holidays, but also giving us time to get some work and engagement over 2024. So Adugna, oh, sorry.
Go ahead and finish. I just have a quick comment before we part. This is Yombo.
Oh, okay, Yombo, please.
Go ahead.
Yeah, so thank you. By the way, I'm so sorry I came late. My apologies. So I may have missed this. Okay. I think I've been on this group on and off for a while. So Lori and I, we have overlap. I'm an oldie. Can we reshare this group's strategy or objectives? I think it's a good grounding step to have. I have been off meetings for a while, so at least for me, it would be useful. And when I hear Lori mention another group that is working on community health workers, that's all fine. I'm all for synergies and kind of collaborating with other groups where it makes sense. So it would be great to maybe take another look or new look at the overall strategy and goal and objectives of this group. And maybe there could be some ideas in refreshing it. So that's what I had to propose.
Okay, great. Yes, and I will share that. I can share the vision and kind of mission of the working group in general. The work plan is still in construction, but we can share some of those initial ideas that we have, but then in the hopes that based on others' interest, we can add to that.
Wonderful.
But yes, we can include that in our follow-up email. Absolutely. Thank you, Yombo.
Thank you.
I want to pass it to Adugna, maybe to close this out.
Yeah, I think it's great that we made today and have this discussion. We are going to have a follow-up probably to each of you individually, just to get more information, and also to get some resources, be it future speakers or organizations that might help us to share the experience in this forum. So just be on alerts and we'll reach out to you. Otherwise, thank you so much for participating.
Thank you, everyone. We'll see you all soon. Have a good rest of your day.
Kristen, thanks everyone.
Thank you.
Bye.
Bye.